Very good afternoon to one and all persons over here. At the very outset, I'd like to thank Padmashri DrVS Natarajan Geriatric Foundation and Venkateswara Hospitals and emergency pharmaceuticals for giving me this opportunity to meet you all. And this next few minutes or so, I'll take you a world of community geriatrics, where you'll be treating elderly at their home. It is not going to be much different for science. For the past 1 lakh years, the human beings have not changed. Several structures have changed, but nature has not changed. Because whenever when you see your pharmaceutical friends and medical representatives, they used to present you a book. This is a newly updated book, 2021, 2019, 2018. So you need to get updated. You can need to be updated. The treatment gets updated. The drugs gets updated. As we all know, whenever a new drug comes, it's after the homicidal of the previous drug. So nothing has changed in the past 1 lakh years. The human beings have remained the same. So we'll be going to a world of elderly, where we'll be seeing them at their home. Nothing much has changed. We'll go through. So I've used a lot of photos, so please do not take photograph. I've taken a video of this. If anybody is interested, I'll give them later. So this is a place where we are coming from. We are coming from Old Pallavaram, and this is the first time when I met BHS Natarajan sir in the year 2013 regarding a geriatric house call project. And this is how even right now it works. It works through telemedicine. So initially the complaint is registered to a telecaller. The telecaller assigns for a visit. They assign for a doctor. We have a huge list. This PDF is very famous. The doctor wise name, the area wise name, the associated hospitals is listed, and the nearest doctor is assigned for the visit. That is how the foundation works for the geriatric house call project. And so we need not take as far as in Chennai Metro is concerned, we have so many pin codes. For at least each doctor can take in charge for 5 pin codes. So which is very close to them, just for an understanding. And right now, to do a geriatric house call project, you need little bit of team effort as you need in a hospital. So you need the greatest strength will be on the staff nurses. So a physician, physiotherapist, like-minded surgeon for you to help, because medicine is broadly divided into 2 specialties. One is general medicine, one is general surgery. All other super specialties, though can be called as super specialties, should be considered as a subspecialty of medicine and subspecialty of surgery, because you need 2 separate specialties. One is medicine, one is surgery, to solve all the problems of elderly. And the major chunk of, I see a lot of staff nurses here. My sincere thanks and gratitude to you, because geriatric house call project will be incomplete without the help of staff nurses. And this is how we do a model, and according to the foundation's geriatric house call project, the call is received and the problem is assessed, whether it is emergency call or it is a casual call, because they might be calling for a general house call, or it can call for various reasons like fall, fever, unresponsiveness. We'll go through that later. And definitely you need to take an audit, so that where we can improve, because for a hospital it is a regular organization, for a house call it is an irregular organization. So we have to keep it organized so that we can reduce our mistakes in the days to come. So after a house call elderly, we should all imagine and believe that life cannot be saved at all times wherever the hospital they go, or whichever the super specialist doctor treats. Life, death, birth is inevitable. So that cannot be changed. So once you see an elderly, we should not be very adventurous telling them after doing this you will be saved, after this you will become normal, because the discharge criteria for elders differ from the discharge criteria as you see in hospital. For discharge criteria in hospital, the wound is alright, the scar is evolving, and the patient starts walking, rehabilitation and discharge. Whereas in elderly, there is no standard discharge criteria. After this days, I can discharge the patient back to the society. That can never happen. So you need some adjustments in the discharge. So only you can reach an optimum level. Whenever there is a problem with elderly handling at homes, you should assess triage. Yeah, because certain red flag signs are there, like coffee brown vomitous and patient sinking, the earlobe sign, which will show you shortly. So the reality has to be explained. Suppose you have a stage 4 carcinoma patient with metastasis all over the body, we should not give them false hopes. So the option of DNR, do not resuscitate, is medico-legally safe, valid, approved by the court of law also. So the real outcome should be explained to the ward's children, and the outcome should be taught. But if there is a treatable condition like hypoglycemia, hyponatremia, so the first option for medical legal purpose and for all humanitarian reasons, the first option of hospitalization should be given to the attenders. If they feel that their parents, their grandparents are so fragile and elderly, they do wish for a last breath at their home. If they will for a home hospitalization, after receiving proper consent that they want their parents or grandparents to be treated at home, they can be going for a treatment. But once you take a decision both from the attenders and as a physician to start home care, you should be fully equipped with the semifowler cot, the nurses support with good diaphragm maintenance, records maintenance, intake output chart. So everything has to be done. So generally, doctors visiting home are generally seen as they get a stepmother treatment. But when I saw, after traveling some 10 or 11 years down the lane, a consultant visits various hospitals. It also takes time, traffic, signals, car parking. He has to park the car, take the floor, take the lift. I feel it is much easier. It is so for those who feel that going to a hospital is more easier. But I feel after traveling 11 and 12 years down the lane, going to home is also easier. And sometimes you will be you might feel disagreed that this is some way. Once you go home, it will take a lot of time. Only the first visit will take a lot of time. After the first visit, the consecutive visits will take less amount of time. So you would have seen these in the past. Yes. And yes, doctors visiting home also has become like this, something with some memories and a lot of enthusiasm. So we will be received well because it is now off the fashion for the past 2 decades. So once you go home, you will be received well. They will say, no other doctor has came to my home. I have requested so many doctors, but all of them have shut down. So you'll be really received well. So this is my experience after 10 years, and this is how we work. And a small story of mine, I was aspiring PG aspirant, so I have written at least 6 entrance exams for my PG. All of them I failed, and they started issuing negative marks. So that is how I visited as a faculty medical officer. I started my career, and then I met my mentor in one of the geriatric conferences. Please do attend Gericons regularly. You will be updated regarding all the scientific data regarding Gericons are organized by medical colleges of various states in India. So that's how you slowly learn. And regarding the management of elderly at home, hyponatremia needs a neurologist care, an intensivist care. How can a home care physician, a physician with MBBS or MD, is he valid to treat medico-legally and professionally? Yes, it is medico-legally and professionally valid, because there is a paradigm shift in the management of ICUs. You know, always ICUs do not, visitors not allowed, visitors no entry. There will be, you know, which is the most deadliest weapon or deadliest instrument in a hospital? It is the stethoscope with lot of bacteria. There are a lot of studies supporting this, and there is a paradigm shift in the management of patients in the ICUs in the West, because ICU psychosis is the biggest problem that elderly faces when they are shifted in a hospital and they are not allowed to see elders. Already they are admitted with delirium, with hyponatremia, and not allowing their relatives to come and see. ICU psychosis. I hope all the hospital inmates could have experienced. You have needed the handcuffs, side rails, restrainers, lot of those things. All this will be reduced, and exposing an elderly at home the day the sunlight will bring him more orientation than the orientation in an ICU. These are all scientifically backed. So who utilizes you? Your co-physicians in the various hospitals, surgeons, oncologists, orthopedicians, all, and your colleagues who will be working in abroad. They might ask to go and see my parents, grandparents. Yes, this is just for job opportunity purpose. And like for elderly, you need an outpatient care also, you need an inpatient care also, you need a home care also. This is just to differentiate. So what helps the patient wise, how they are helped when they are seen in a house call? Whenever they are seen in a house call, whenever they are receiving, they are coming to the hospital, they have lot of problems. The moment their time comes on the token number, they might rush to the restroom, or they might soil the place, the hospital, with the stools and urine, and there are a lot of nosocomial infections, because as we all understand, elderlies are immunocompromised. Our doctor also has rightly said diabetes, hypertension, 1/3, 1/5. So all lifestyle diseases are immunocompromising. So for them, visiting a hospital with the chances of nosocomial infections, all these infections can be reduced by a single visit of the doctor at home, and for a doctor to do a diagnosis. Because in a hospital with the case sheets, you will have lot of opinions pumped in, and there is now because in some hospitals alone you have a team discussion regarding a patient, especially a very sick patient. The neurologist sits, the physician sits, the critical, there is a board meeting. But nowadays board meetings are also becoming sparse. With all this discomfort, as a house care physician, as a home care physician, single-handedly you can take diagnosis. When there is a problem, we can take the help of seniors like Dr. Thillai Vallal sir and various physicians in various places, as doctor has already invited us to take the help for various reasons. So already the one of the senior representative has mentioned, geriatrics will be expecting a peak practice by 2025-2030 because of reduction in death rate and reduction in the birth rate. The graying of the nation is expected more. So this is to ensure you to take up the field of geriatrics for the postgraduates, especially who have felt that I didn't get MD General Medicine just because of my rank. I have come to geriatric medicine. So please don't have any regrets. This is one of the best field, and as far as everything is concerned, both finance, both your job satisfaction as a physician, everything you will be satisfied. So now we will be entering into a house call. How do we do a house call? You should get an informed consent that this person will be getting treated at home. Need not waste much time on this. Basic details like name, age, sex, identification number, some PAN card number or Aadhaar card number to know whom we are treating to. We have to check a basic vitals of blood pressure in both sitting and supine, because in elderly this orthostatic hypotension is very common. So please take blood pressure both in sitting and supine position. 1 minute pulse rate, please, and in this purpose definitely you can believe on your pulse oximeter. Many times it gives an excellent pulse rate recording and saturation recording, blood glucose, and please always see the conjunctiva. Many times elders will having pallor. Please examine the aortic area as far as CVS is concerned, because many elders do have aortic stenosis and many times murmurs, and that might cause easy fatigability and the general decline of elderly. Nallada irundaru kadanda or 2 varama nadanda moochu vaangudhu, he is not as before. So aortic stenosis is very common. For respiratory area, please check for bases. They might have gradual onset of pulmonary edema, slowly starting with little bit of crackles. Per abdomen, always please check for the bladder area. Several times they are with a full bladder even up to the umbilicus, and you will encounter them as irritable elderly syndrome. The elderly is not sitting anywhere, he is pushing. As you know, whenever there is an option of given a good lunch and a restroom, which you will prefer first, you need to empty your bladder. With a bladder full, never you can release even the best of the foods. So that is the base of causes for acute restless elderly. So please examine the bladder area, umbilical area, and the groins for bowel sounds and any obstructed hernias, because elderly are generally they are neglected. Never like for child we generally pamper, we touch, we squeeze them, we touch, we put them. Elderly are never done so. The vesti and the sari, what the nightie what they are using will always cover all the important parts, and you miss the important structures like umbilical hernias and inguinal hernia. CNS look for gait, rigidity, weakness, balance, because Parkinsonism is an underreported disease. The Parkinsonism what we see in hospital is only the tip of the iceberg, because many times these symptoms are taken as part and parcel of aging. That is the rosary sign, the pin rolling movements, the slowness, the paucity, rigidity, tremors, depression, constipation are never taken as signs of Parkinsonism. They are understood as otherwise elderly, vayasana ipdina irukum. Please always check the lower limb. You can see edema, cellulitis, ant bites, several times ant bites, intertrigo. What are all the expected emergencies that you are likely to see are falls, fevers, unresponsiveness but breathing, unresponsiveness completely, different behavior, cancer, lower limb stories. Falls, generally the fractures are related with the femur fracture, the commonest fracture. Then the spine compression fracture, the radius ulna getting fractured in the order of priority I have mentioned. So whenever there is a fracture, please ask them whether the elderly was walking already, whether he was doing these activities of daily living. If he has done already, please suggest him a surgery, because surgery will get him back his normal life. If he was already bedridden with the assisted living, he has slipped and fall when nobody was there, surgery might invite more trouble. So fever in elderly is very common, as you all know in general medicine, above the umbilicus, below the umbilicus. So above the umbilicus you expect gram positive bacteria, below the umbilicus you expect gram negative bacteria. Commonest infections are URI, LRI, TB is also very common in elderly. It is not an uncommon disease. And below the umbilicus, urinary tract infection, pyelonephritis, diabetic foot and bed sores are very common. Unresponsiveness but breathing, the elderly is still breathing. It can be hypoglycemia, a CVA or a hyponatremia. All these are treatable both in the hospital and at the home. It is treatable. So get a consent, know about the inevitability of death and explain regarding the pros and cons, and then start treating them at home. For issuing death certificate, never decline giving a death certificate if you know the family already. Please, if you don't know the patient already, never issue a death certificate. Because issuing death certificate is not a problem, but it is a responsibility by the court of law for a physician living in and around the doctors, and in his working office hours, it is a responsibility of the physician to issue a death certificate. Look for medical records. Look for the members. Are they crying? Are they having a sad face? Or because you can expect lot of foul play in elderly, because the grandfather would have written, all my children and grandchildren can they can enjoy this this property only after the grandmother's death. So grandmother is an obstacle for enjoying all this property. The grandchildren nowadays, they are very cunning. Now a lot of foul plays are there. Please look for the family members, any mysteries. But this is not to frighten you. Please take a closer look. Please issue death certificates and Form 4A. Please maintain a duplicate copy. Issue only in office hours. Please maintain photo evidence. Unresponsiveness in breathing, hypoglycemias and those things I have already mentioned. Regarding the different behavior, it can be hypoglycemia again, hyponatremia, neuropsychiatric drugs that the elderly are already taken. To treat the cause is very important. We have to withdraw the drug, which is because once the elderly would have been very aggressive, they would have been taken to a psychiatrist, they would have been prescribed haloperidol, olanzapine, mirtazapine, but after a point of time, the snake has lost his tooth. And after that, the elderly are no more aggressive. But maintaining the same doses of mirtazapine at 15 and 7.5 will be too much for the elderly, and he will start aspirating, coughing on eating, and slowly he will decline and end in death. So the psychiatric medicines, yes, the elderly could have been aggressive at a point of time, but after psychiatric drugs for a long time, they would have reduced. Cancers, yes, it is very much in elderly. All cancers are more common. As the lifestyle diseases are more, GI malignancies are also expected more. And metastatic cancers, and you know, for cancers, only palliative care is more than sufficient, giving IV fluids, catheterization, rice tube feeding. It's a nurse's job, excellent job. Never regret for going to a house call treating an elderly. It is always very good and rewarding. Lower limbs, yes, pedal edema. Pedal edema, as you know, the 5 common causes: anemia, liver function test, your echo, where the EF can be low, the creatinine can be more, or the TSH can be hypothyroidism. Please look for these 5 causes. Very common in elderly. You can pick up lot of stories, because several times we never take time to look the foot, because dorsalis pedis artery, posterior tibial artery is very important and palpating to check a diabetic foot. Seeing an edema also is very important. So this is a rough idea of giving a house call project. It is just to see that females are more living in elderly, so you expect to meet more parties than tatas, and several times it is 80 to 90 years that they are more alone in home. Several times you will be called for a routine checkup, fever, falls, confusion, and several times you will get a call for life certificate also, that I am alive at 87 years, I need to receive my pension, please certify that I am alive, I am non-ambulatable. So this is just to give a rough idea of the clinical photos. Vertigo is very common. Pressure sores are very common in elderly. Parkinsonism also very common. And the COPD also is common, because all elders, though they look very pious and very saintly at this age, would have been already smoked for 40 years. 40 years, 50 years they would have smoked. Only they, when you ask, I don't smoke, they say. Then only the wife will come, illa ஒரு 2 வருஷம் தான் ஆகுது அப்படின்னு சொல்லுவாங்க. டாக்டர் பிடிக்க கூடாதுன்னு சொல்லிட்டாரு, ஸ்டென்ட் வச்சிருக்காங்க ஹார்ட்ல, அதுக்கப்புறம் பிடிக்க வேணாம்னு சொல்லியிருக்காரு. ஆனா அவங்க போட்டீங்கன்னா பட்டை கிட்ட அடிச்சு பயங்கரமா இருப்பாங்க. Don't get deceived by the book of cover. So prevalence of chronic kidney disease, there will be happy couples also, husband and wife living alone, but still they are very happy because they are not with the 10 sons. I mean tension, no tension. So all the sons are abroad, they in UK, US, living alone in a isolated families there, because there you cannot have such a huge get together. So still there are several couples very happy, and they're taking very care. And you will also see elderlies in this model also. Sarcopenia, very common, that is loss of muscle mass. They also like to take photos. You are all having your cameras, please take some selfies. They enjoy, because nobody comes them to take, other than Aadhaar card and PAN card, they have never been photographed. So please go take some photos. They also enjoy. Send to their ward children. They will say, doctor nalla paathukkararu, amma oda ninnu photo la eduthirukar. You will be rejoiced. And yes, this is just an acute retention of urine. After catheterization, they feel very good. Unattended gallbladder stone. What we saw in fat fertile females in 40s, after that the same 40 female would have become 40 now, and that single big gallstone would have come and dislodged in the gallbladder neck and giving right hypochondrial pain. Several times we will take the help of the hospitals to do a laparoscopic surgery, because here home treatment will not help. They have to be shifted. And old Parkinsonism patient, for some time they will be meeting the neurologist. For years together they will be taking same levodopa 5 times, 4 times, but the same dose will not be essential, because as you all know, Parkinsonism is a neurodegenerative progressive disorder. The disease progresses, but the volume cut at that time will not be helpful. They might be ending in hallucinations with levodopa and carbidopa. So the prescription needs to be monitored. So that is very important. And you will see all like these kind of faces. You will get daughter-in-law coming by Mamma and Papa and Pati. It will be like part and parcel of Parkinsonism. You will get this kind of faces also. And old stroke patients, if they are because of atrial fibrillation, after some time with depression, they would have stopped all drugs. 3 வருஷமா நான் எந்த மாத்திரையும் போட்டுக்கிறது இல்லை. AF ஓட மாத்திரை like Cartron or blood thinners, nothing they will be taking. They will be ending in recurrent strokes. Already we know strokes are recurrent, and the elderly stopping tablets after some chronic depression. என் பையன் யாரும் என்கிட்ட பேசுறதுல, காஃபி தண்ணி வைக்கிறதுல, சாப்பாடு கேட்கல, அந்த மாதிரி ரொம்ப they are depressed. They will stop all drugs. Please go restart the drug, whichever is very essential. Stages of bed sore, diaper rash, because you know they are all looking very neat outside, but they could put Huggies from 24/7. Constantly snapping the genital area, you can expect diaper rash. If left, they go for decubitus ulcers. Wagner's grading stage 1 to 4 holds good even in decubitus ulcer. You can also help certain children with muscular dystrophy, because there is a chance to go to home, and for these things also you will be called in for. And I like to acknowledge Padma Shri DrVS Natarajan Geriatric Foundation, with the help of Mr. Rajshekhar, also the co-founder and managing trustee, for giving me opportunities year after years. So I'm very thankful to them. He is my teacher, Professor T.L. Andumani sir, who is my anatomy first year class teacher, who has asked me to document everything, whatever you have seen. It always holds good because in the case sheet I will write whenever they come in OPD. That time they were listening this song, that song, whatever I note I will write. Next time in the doctor, so you'll be really welcomed well. And this is the first time when I met DrVS Natarajan sir. Probably you will see 10 years back the lane sir, this photograph. And my sincere thanks to Professor T.S. Kanaka madam also, who is a neurosurgeon, and she has also helped our center in a big way, supporting in all possible help. And this is our center staff. Our center staff, the biggest strength of our center are staff nurses, because they are the spoke of the wheel. And I always I never ask them nurse paatha podum na solla maten, nurse paapanga apra engu solvanga, nurse dhaan paatanga, அந்த தாங்கற வார்த்தை நர்ஸ்ல கண்டிப்பா பயன்படுத்த கூடாது, because together you win. A hospital will never breathe without staff nurses, because I see, understand doctors without any idea they do have some superiority complex always. So that should be lost. Together we are a team, both with the non-medical worker, the paramedical, and together we have to work good, because in a house call it is very, very essential. And this is my family, my father, my mother, my sister, my daughter, and all of them have helped, because sometimes you need to go in odd hours. With the family support is very helpful. And this is the Pallikarnai marshland, which is very close to our center. Whoever are interested in watching, observing, having one day observation at our center, you are welcome to visit our center to know our routine, how they are working. And after coming here, this is a small new this is tourist spot that is open near our center, Pallikarnai marshland, Sadupanilam. So you can visit this place also. Thank you for your patient listening.
Brilliant, I really appreciate it. Amazed with great. You can appreciate his passion for his profession. A lot of interesting points. You also blood from here. Great, thank you. The master teacher. Thank you. Great, a small token of thank you for you. Thank you. Thank you. Thank you. Excellent. Thank you. Keep it up. You understand the passion drives you. Thank you. Thank you. Thank you. Thank you.
Thanks a lot, Dr. Venkateswara, for the discussion. This is the second time we are listening. Last time we had in OT, I think we had a good number of candidates from the This is the second meeting, sir, this year. So this is the second meeting, sir, this year. The first meeting was in Hotel JP.
Yes, sir.
A good number of participants was there. We had an opportunity, excellent opportunity to listen to you, and all those are the PG students of the Geriatrics, those who come forward here would have benefited from this. And I personally had an opportunity to visit a couple of times to center, worth visiting, and there is a significant contribution. We request you can go and make it. There are a lot of opportunities sir gives. If someone who is not able to, someone wish to do contribution to the society, but we don't know how to do it. There are opportunities provided by them. So you can feel that you can also contribute to them. That's another way we can satisfy ourselves. And we have a small video of 5 minutes on weight watch.